Unbelievable. Well, we are bringing you facts, not fear, as coronavirus cases rise across Arizona and the nation. As the pandemic continues, we're learning more every day, but we still have questions, and we know that you do. So that's why we brought in Dr. Frank LoVecchio with Valleywise Health Center this morning. Good morning, doctor. Thanks for being with us.
Good morning. Thanks for having me.
So obviously the big talker this morning, vaccines. Both Pfizer and Moderna have applied for emergency use authorization, hoping to get those vaccines ready soon. So with multiple vaccine choices, how do you know which one to choose?
Well, to be honest, I'm going to take the first one that's offered to me, and I think most of my colleagues feel the same way. More likely than not, I don't think we're going to have a big choice initially. Hopefully by the summer, the public will have more of a choice. But it seems like so far Pfizer is going to win the race right here in Arizona, and we'll probably be offered that in about 2 or 3 weeks.
So when talking about the University of Arizona, they're now recommending a 3-week, oh, sorry, Ryan, go ahead. Do you want to take this one?
Yeah, sure. You said U of A, they're recommending that 3-week statewide shelter in place to avoid a hospital crisis. Do you think we need another lockdown at this point from your medical standpoint?
Well, I think the numbers are going all in the wrong direction. And if you look at hospitalizations, on the 1st of December, it was about 96,000 Americans were in the hospital, double than what it was the month before and triple what it was the month before. So we're definitely going in the wrong direction in our state. We're at high capacity. You know, does a lockdown help us? I mean, it'll probably help the hospital, but it won't help the people in the sense that they, lose work, et cetera. The kids can't go to school and all of that. But I tell people to just hang on, do what you can. The vaccine is almost here. We'll approach normalcy in the summer.
Yeah, we sure hope so. So what is the situation at the hospitals? I know we've heard a lot from Banner Health. They've been sounding the alarm for quite some time. We're hearing these numbers about the issues with ICU beds being available. What are you seeing from your perspective?
We're seeing that the patients who come in now are sicker and they're more likely to be admitted. And it's not because the virus has changed that much. It's because the patients know now. They know to go out and check their oxygen. They know the signs and symptoms. Maybe they're doing an electronic visit with their doctor. We do know that the hospital beds are approaching capacity, certainly where I work, which is, inner city, which is going to be hit the hardest. So we're about 90% capacity. It's inevitable that we're going to have an overflow, and we're going to have to make do with certain places that don't normally have patients, holding patients.
Dr. LoVecchio is going to be with us throughout the morning. Continue to text us your questions, 602-444-1212. We're going to get to as many as we can with him. So, Dr. LoVecchio, thank you. I know you're standing by.